Well, there's nobody more excited about ringing in the new year than the government. Because when 2014 strikes, you'll be getting struck with a list of new health care taxes. Everything from investment income to medical devices. That's why Jamie Weinstein says it'll be anything but a happy new year. Jamie, we keep hearing about all of these different taxes, and it gets a little bit confusing. So run down some of the new hits that we're going to be so lucky to get in just about 48 hours.
Well, right, Charles, as you said, if you think Obamacare couldn't get any more popular, get ready for 2014. Besides the millions of Americans that are expected to be thrown off their health plan in 2014 or see their coverage significantly altered, many Americans are going to have to pay many more different taxes, including on their health care premiums if they are in the Obamacare exchanges. There's a $2 penalty, or fee, I should say, for those in the exchanges per plan that they're on, as well as a 2% tax on their premium that aren't being factored in when they're looking on the exchanges right now in many cases. So they don't know that in addition to the higher premiums that they're seeing if they were thrown off their care, they're going to have to pay a 2% tax on that plus a $2 fee, and that's just to begin with.
Then, of course, the individual mandate kicks in, and you've got some other taxes. And also, from what I understand, the taxes on these premium, these great plans, the Cadillac plans, even those have a lot of loopholes, and it feels like if you're connected, maybe in a union or something like that, you don't have to pay it, but the smaller businesses will be hit, and that obviously means that the employees will be hit.
Right, and there's also some subtle taxes that aren't direct on the consumer, but will ultimately be passed to the consumer. There's a tax that insurance companies have to pay to be part of the exchanges. That's a 3.5% tax, and also a medical device tax on things like pacemakers, 2.3% tax. But at the end of the day, that will be, have to be paid by the consumers. So that will just be trickled down to them.
I saw a report out of Heritage where it said it could be up to $6,000. Why do you think that this hasn't been advertised? I mean, I can understand why the administration wouldn't advertise it, but, why hasn't someone gotten out there? And I mean, of course, that's why we have you on the show to at least educate the public. But these things add up to big money.
Well, of course, this is in 2014. This is after the 2012 elections. A lot of these, painful things with Obamacare were kicked down the road till after the president was elected. And as much as, conservatives or the GOP tried to herald these taxes, people don't pay attention until they're affected by them. And come 2014, they'll begin to start feeling the pain of what Obamacare will actually cost.
And Jamie, I guess, is it safe to say, too, even with all of these taxes that they put out there, they're probably going to have to find more ways to raise money because so far the enrollment hasn't lived up to expectations. People aren't taking the bait on some of these offers. It feels like to make this work, we're going to even get more taxes.
Well, the government might have to bail out insurance companies in order to subsidize them in the case young and healthy people don't sign up in the exchanges, which the evidence we have so far, it's very limited, granted, is that they're not. So, yes, there could be more taxes on the rich, perhaps, in order to pay insurance companies to subsidize them for kind of not getting what they thought they were going to get, which is young and healthy people to subsidize the sick and the old. So we're just beginning in 2014 to see what's in the bill, as Nancy Pelosi once famously said.
She once famously said, but she didn't tell us it was Pandora's box. Jamie, thanks a lot. We appreciate it.
Thank you.